Welcome back to all of us.
Yes. Okay. Good evening, everyone. Welcome to webinar on how better facility management can help businesses reopen safely during COVID-19. This is organized by GVP Consulting Private Limited. And my name is Suman Ramurthy. So joining us here today are three experts representing different part of our industry. First, we have Major Awal City. He is the head of procurement at Embassy Services. Awal brings in over 26 years of rich experience in multidisciplinary areas of supply chain and procurement, strategy, operations, facilities management, and process improvement. And we have Meenal Sinha. She's a founder and CEO of meetingsandoffices.com. Meetingsandoffices.com is a BIPP accredited startup and a winner of NASCOM Product Conclave 2017 live funding event. The company is founded and managed hands-on by Meenal Sinha, herself an exceptional woman of excellence awardee by the Women's Economic Forum. And we have a Major Aditi, who is Vice President and Head of Corporate Services at Fidelity National Financial India. Managing her India's operation facilities, including infrastructure and administration, transport, security, real estate, project, procurement, travel, hospitality, client management, and crisis management, and other software services. She initiated the FM COVID task force groups, which had a representation of all the FM heads, including security and CRE builders, services, partners as well. So now I will leave it to the experts for their insights and their inputs.
Thank you so much, Suman. Thank you, Suman. Thank you for that wonderful introduction, and welcome everyone. We have always been on webinars, and this is one of a different kind because in a lot of webinars, we have a set pattern of questions, but we wanted to have more of a discussion amongst ourselves. So the representation that Mr. Suman and the GBB venture has chosen is primarily from the building perspective, the co-working perspective, and of course from the FM perspective. So with this as a background, do not expect set questions from between us, but we would have a discussion and we'll give you an overview of how we are starting our facilities, after the lockdown and what preparedness has gone into it. So I think we will have, now that we have two ladies out here, it's time for us to actually pass the baton on to Major Awal Sethi to start off, sir. Over to you, sir.
Thank you, Aditi. And thank you so much, Suman, and to GBP Ventures for having given me this opportunity to be able to speak on this platform. So I'm going to start off by saying that today we are living in a VUCA world, a volatile, uncertain, complex, and ambiguous world. However, this acronym VUCA will now need an extra C because it's a crazy world that we're living in today. Look at how we started 2020 and where we are. It's not just been the COVID-19, but we've had cyclones coming in one after the other. We've had one in West Bengal, Mumbai is looking up to another one. And there have been so many other instances that have happened. When we look at COVID-19 itself, the repercussions of the COVID-19 outbreak are being felt more strongly with each passing day. And despite the unprecedented steps and the cumulative efforts that have been undertaken by the businesses, the governments and individuals to stem its growth, the virus continues to rampage unchecked across the globe. And that is causing a loss of life, hitting the businesses across industries and verticals. And if we actually look at it, we are currently living in one of the largest upheavals in history. And what has been India's response? Probably, again, the world's largest lockdown. When we look at it globally, there is social distancing, which has kind of become the new normal. The COVID-19 still remains a silent killer. We still have no clue about what this is all about. There are no drugs or vaccines that are available. We still have no idea. Millions of people have been affected and there are numerous people who have died. So that's the ecosystem that we are today in. And all this is driving a certain change in our behavior. Now, obviously, so one aspect is the behavior. The other aspect is also what is our perception towards our work. Now, as people, we are probably becoming more sensitive and going to be more conscious of our crowded workplaces. We've been working from home, we've been operating on technology, so there is going to be a lot of digital empathy that's going to come in. There is also going to be a lot of community awareness. For a lot of people who are working from home, their homes have really not been kitted up to be able to effectively work from home because they have small confined spaces in which they may have elders, their own spouses, their kids jumping around. And imagine these people trying to take a video call or calling their colleagues or their bosses and so on. So the line between official work and social has blurred to an extent that it is leading to a rise in mental health challenges. And therefore, awareness in mental health is going to be a big factor as we move forward. That definitely is going to be something implement in probably a time frame of 2050 is going to speed up, and we'll soon start seeing some of these new technologies coming up in the next few years. But the biggest factor, what we've also realized is that definitely there are some functions, there are some roles that can be operated from home or from a remote environment out of our standard office setups. And there has been an ease and the reliability of these people working from home. So that actually poses a few questions as we now start to look at heading back into office. And some of these key questions can be, how do we ensure the health and safety of the people as we're trying to move back into the offices? From day zero, how do we ensure a first time right startup and sustenance of what everybody is trying to call the new normal? What should be the optimum occupancy ramp up plan to maintain a business continuity? How should we optimize operations and some of our costs that are really going to skyrocket in the initial couple of weeks and months? And how do we manage in the new set of constraints? How do we become more compliant to the government regulations and so on? Now, there will be a number of challenges as we start to move into our offices. And the way that I look at it is these challenges will be twofold. One set of challenges will be which will be coming up from our internal stakeholders, and the other set of challenges from our external stakeholders. Now, when we look at our internal stakeholders, some of them could stem from employee-related issues of how do we ensure they are safe, how do we ensure a hygiene and clean environment, how do we create more touchlessness within our facilities and so on. The second aspect will be around facility management itself, of how do we sanitize our areas, how do we occupy our facilities and so on. And the third aspect is going to be around the support staff. How do we really roster and how do we identify people coming in from containment zones and so on? And how do we protect our people? How do we issue personal protective equipment to these people and make sure that they utilize that equipment? When we look at external stakeholders, there is going to be the government and the regulator. And we are seeing that almost on a daily basis, there are new norms, there are new guidelines that are being given out, and all businesses, individuals, employees are expected to follow those guidelines. We will also have to look at our external third-party arrangement. So our supplier partners who service our facilities for equipment or for services and for material consumables. Also, how do we deal with our visitors who come in for engagements and for meetings? But more importantly, also, how do we interact with our landlords and our space providers? How do we engage with them to ensure sanitization of our common areas? Some of the guidelines around visitor entry at the main gates. How do we ensure temperature screenings and some of these aspects? Now, when I look at it, I think there'll be a few key drivers of these changes and what I call the three pillars. The first one, obviously, is the leadership. and leaders will have to lead from the front. And like Aditi and me coming from the defense background, we've been very used to leading from the front. So we have to be there with the people, for the people. We have to make sure that we give them the confidence that we will be there and holding them back. The second itself is about the talent, the people. And people in this environment are going to be more demanding. They will expect more autonomy, more freedom, more say in whether they want to come to work, whether they want to continue to work from home, and so on. And the third is also about bringing in more innovation into our workplace, more biophilia, more environment, more natural landscape features, and other elements for creating a more productive and a healthy built environment. So with that, I know Aditi has been working extensively in this space. She's created a number of task force. She's been working with some of the external agencies, with the administration, and she's done a lot of work in the space. So Aditi, give us some of your perspective and how you're setting up offices and facilities. You're on mute, Aditi. You're on mute.
Thank you very much, sir. You're right. There has been a lot of work that has gone in from our end as well, which when I'm talking about our end, it's not only individual, but also from the FM industry. In fact, even in the normal times, we never had so much of camaraderie. But COVID has actually brought us all together, and that is something that is very, very overwhelming to all of us. There has been a lot of best practice sharing that is happened across India per se to prepare our facilities, because people thought about during the lockdown, people thought about how the government agencies have to operate. But what they missed out on was how the corporates are going to actually operate. So that was one challenge that we had. And we had to prepare our side because people were working from home. Coming to my own organization, and we really did foresee what is going to take place. And probably we were, as you said, leading from the front. We were already planning around it. So uh, whether it was the delivery of the systems or whether it was arranging vans and everything else, that was absolutely taken care. Not only that, but also your new systems, your laptops, your rentals. So that part was taken care. Now the challenge came: when does the lockdown get lifted, and how and when my employees from a different district or an interstate travelers who come into my facility, am I really ready to actually receive them? So we followed the 4P parameters, and I call them my pillars, as you mentioned. So they're the 4Ps that I kind of concentrated on. My first was obviously, and first and foremost, was people. When I talk of people, I really knew that not only my employees, but also my employee staff, which is the service partners, this was of paramount importance. The employee data collation, where they were, where they are not, how many days back they have come into, what are the zones they are living into. So that is something that became very handy for us. The second, of course, since we also give transportation to our employees, transport management and the right kind of communication was very important, whether it was related to your hygiene, because that's the first thing an employee comes in contact with. There are own transport users, so anyways, the government agencies have passed the order. So that was another aspect of under the category of people. The third criteria was, what about the foreign nationals? Now, this was obviously floating around, and of course, the hotel facilities and the hospitality segment really stepped up, and that was also taken care. And we all know that the evacuations are already happening, and the stranded the foreign nationals are being sent back to the respective countries. The second parameter of the P was my premise. Now, looking after my premise became so important because you had the security involved in it, you have the HVAC systems, you are dealing with the builders, the waters haven't changed, the air filters haven't been cleaned, you have the housekeeping, so the deep cleaning had to be maintained very well. So not only that, in fact, very little things, as they say that necessity is the mother of invention. We became innovators. It was a complete lockdown, and we used our raw materials not only to make hands-free sanitizers, stands, to the extent of having safety kits. This, in fact, became so famous that a lot of our FM partners, they ended up making these safety kits where you would welcome an employee and you would have your instructions in it. You would have a safety key so that you do not touch anything around, and it will help you. And that's your own personal safety key. And of course, your sanitizers, your PPE, which had your pair of gloves, which had your mask, that was being offered as a kit to the employee. So this was one aspect, and from the moment you enter into a tech park to the moment of the distancing, where your stickers are in place, getting into the lifts, which were really marked across, and how an employee will have to come onto the floor, get inside the reception area, get inside your workstation, get inside your cafeteria. Your seating had to be taken care. So there was a certain amount of discipline that had to be maintained. Advisories, safety protocols, these were things that we worked around. The third P also came around was your property management and maintenance. As I spoke, because buildings had been shut down for a while, your systems were not working. You had to ensure that your desks are okay. You had to ensure that your taps that are manual in nature, because some of us are already sitting in the old structured buildings, you would need to have sensor taps when employees come into place. So these are the things that involved us in our property management and maintenance as well. Not only that, but is also your disinfection of the facilities, which definitely holds importance. The last but not the least, the last P was my POA, which is your plan of action. So the government orders, we are all aware, the MHA orders, they kind of change in a flash of a second. So you have a lockdown 1 and a 2 and a 3 and a 4 and a 5 now. Probably we'll also have another lockdown 6 after the phase 1, 2, and 3 is going to. MHA orders are changing every moment. You have the BBMP war report. It is so important to have that communication and pass on to your employees. So that had to be taken care of, because we also had some critical resources working out. So how your operations are going to be taking place, how are you planning to get your employees inside? We know that today, where as Karnataka stands or across India stands, we are authorized to have 33% of your employees coming into your workforce. But do we really see that percentage coming into any organization as on date? I am not sure. So there had to be a phased manner approach, and this is a communication that had to be taken care of. So there's a lot that has not only gone in from a particular organization, but we as of FM industry had made sure that if we are doing something, we are all on the same page. When it came to the security protocols, when it came to commuting of employees, when it came to the employee movement at the curfew timings, when it came to the electronic passes, or when it came to the transportation of the material and the movement, or when it came to the interstate travelers, when it came to connecting with the health departments or the law enforcement agencies, the support that everybody had, even to the extent when there was a personal, individuals' cases where there was some deaths happening in an employee's place, how anyone would travel from one district to the other, or maybe interstate as well. So these are the things that came very handy. And if I have to say today that is a facility ready to have an employee on floor, yes, it is. Because even today, when we have the BBMP war reports coming out, I'm specifically talking about Karnataka right now, which is published in the evening, we ensure that it gets circulated not only across the organization, but across the industry, such that when you have an interstate traveler, or when you have an interstate inter-district traveler, you know that you have a containment zone in place. That probably is a challenge, because you also would have certain new joinees coming onto your floor. And that is when you need to ensure that you're not breaking that thin line, because we're talking about keeping your facility COVID free. And as we all are, as Major Raval is there, Needle Ma'am is there, Suman is there, and there are so many FM heads right now with us. We are the nodal officers, we are the point of contact. And as we know that the the first support that any one of us in our position today need is the leader's support. And God willing, this is the time that everybody came together, and things really became very easy for us. So that is all I have to say, sir, from the preparedness perspective. But Meenal ma'am, I'll bounce on to you, because you come from a co-working space, and we all know that now we know that there is a distancing that has to be maintained across the industry. And how is your business going to take up this challenge, and what are the different things that you've been doing? How well are you prepared to receive the organizations into your spaces? You're on mute, ma'am.
I think we are all going through that phase, muting ourselves for the others to speak and then forgetting all about it. But thank you so much for throwing such great light on how well you guys are preparing, and the organizations like yours are preparing to get people back safely into office spaces and workspaces. That was very, very enlightening. And I would like to thank all the participants at this point for being here and listening to us. I think they had a choice, as always, to be elsewhere, but they chose to be with us. So thank you so much for being here. Before jumping on to the co-working industry, which I know people say I know a little bit about, I would like to very humbly say a few things about the corporate world as well, which will apply both to co-working spaces as well. I think any corporate which is also looking at opening up their spaces to employees, I'm sure all of you have, as facility managers, taken all the necessary steps to keep it ready in terms of the sanitization and healthcare safety measures and everything. But when it comes to implementing these measures and making sure that everybody is following all the protocols, like both of you said, both Major Raval and Major Aditi said, it has to be top down. So if the leaders are showing their employees and the entire team that yes, they are also investing in this, they are also following all these measures. And I think a simple thing like inculcating these habits is not going to be very easy. So if there is a simple thing like everybody watches out for everybody else, and you have simple things like if the other person is not doing, somebody very simply points it out, and it could be your MD who's missing out on a simple protocol that has been laid out. And even if the junior most employee has pointed it out to the managing director, the managing director very humbly responds with a thank you so much for pointing it out to me, and follows the protocol. I think it has to start from there, and the leaders have to set an example and lead by example, because unless we do that and we take the protocols that seriously, it is not really going to be impactful. Because
so, ma'am, sorry for interfering, and you mentioned a very, very fantastic statement. I understand that life is very important, but you said leading from the front. Major Raval as well said leading from the front. So believe you me, and all the FM heads out here, we know that even our own lives as FM heads is very, very important, and we need to be safe. But yes, with precautions. When you say lead from the front, it's always, walk the talk. So to an extent that most of us who are managing the facilities were on the ground, standing for the passes, doing the deliveries in the middle of the night.
It is not about you preparing the facilities now. You have prepared the facilities. Now it is everybody else and the management also coming to work. They have to follow the protocols that you have set with
yes,
much pain and effort and dedication.
Absolutely. And so certain challenges also come up. So Major Raval, coming to the embassy services, I mean, has it been very difficult? Have you started operating, in our tech parks? I know that the builders, whether it is the Prestige or the Brigade or, and Cessna itself or Umias, they've been very, very supportive. In fact, I do see those changes, and they've gone to the extent of making sure that, we work hand in hand. So when it comes to your tech parks, how well are you prepared when you want to receive the employees into your tech park? Do you say that are you safe and you are ready, to open up completely?
No, no. So absolutely, and I think the fundamental philosophy of embassy services is our clients are of the utmost priority and most important for us, and we will make sure that we take the utmost care to ensure a foolproof, safe environment for them. And while a lot of our clients have actually not been coming to their offices within our business parks and all, but it's not that we've ever let our guard down. In fact, we've stepped up all activities that we've been performing. So whether it is creating new processes, new system, bringing in more and more safety elements into the workspaces, we've brought in a lot of these equipment to screen employees, higher standards of sanitization, and so on, with the whole focus that we are there for our clients and for their employees. And at no point in time should they ever have that doubt that there is something wrong in the facility they're walking into. So right from the front gate, from the moment they walk in to how they will be screened, checked, and till the time they board a lift, for example, to get to their floor or within their own office environment, it is something that we've really, really taken care of to ensure that safety of those people are of paramount importance.
In fact, taking on from there for your co-working brand, WeWork, it was like one of the co-working brands. Of course, all the co-working players have been and have implemented the measures even when much before the lockdown. But WeWork was one of the players who had implemented all these temperature checks and making sure that there was no crowding at any of the community places much before. And right now, like Major Aditi, you asked me, all the co-working players, so me being an aggregator of co-working players, we are in touch with all of these players across the country, and we have something out of there. And it is a real concern with all the clients and all the inquiries who are coming in, because they ask me questions, how are they going to take care of us? So everybody has their safety protocols out. They are already, so their teams are, going again, their facility management teams are again like you, they have their task force. They are going, taking care of the sanitization. They have markings on the floor in the community places. Furniture has been removed. There are only so many people allowed at certain places in the community zones, and lifts.
I think what, Mama, I think what also makes
all the markings and everything has been taken care of, and all the protocols like the World Health Organization has, and like all the facility managers are doing, they are all taking care of those. And sanitizers, health temperatures, and everything, the basics are of course in place, and they have the entire guideline. How many times during the day will the surfaces be clean, to the extent that they have stopped the common cafeterias. They have stopped the common coffee points at some places, and only certain machines will be available. They have asked people to bring food from their houses, water bottles from their houses, and everybody is taking a certain amount of care. So to ensure that not only are your own offices safe, but even the co-working community is safe. And they're organizing boot camps to tell their community as to how, so earlier people used to only come for fire drills. So now there is a COVID-19 drill, there is a boot camp safety. As to, you need to do these things. I'm sure you must have done it for your organization when they started coming back.
So earlier in the tech parks, the situation used to be that the tech park security guard may not know that, how many, someone like me is coming in. But with the lockdown, I think probably he saw only one soul moving around in the entire tech park throughout the lockdown. And now he makes sure that he opens up the gate for few of us. So that is one. But a few pointers that I would want these people to take along with them is that, now that you are going to be back in your offices, these are certain guidelines that you have to adhere to. There are MHA orders. It is very important and imperative to make sure that you're not flouting these orders, because, there could be a situation where an employee who's actually traveled inter-district or interstate, ends up telling you, because now that the borders are open, that he has been in Bangalore for a while. This could be really, really difficult situation for all of us, because we've been working hard. And if that happens, then if he has touched your floor for another couple of days, or maybe 2 days or 3 days, it could actually put and jeopardize your organization, and your entire effort has gone waste.
Yes.
And this is an information that is as late as yesterday, not from my organization, but from an organization. And we know that we've been already sharing a lot about it, that please do an employee data collation. Please be very, very truthful about it, because the employee comes onto the floor, he stays in a PG, his fever is not come down, because you would also have asymptomatic people. So make sure that, one, you do encourage employees to stay at home and not go out, even when you go and venture out for as a small things like buying groceries. You should know where have you been. Keep yourself a tracker that where have you been, because we know that how things are traveling. That's one. When you're in office, ensure that you're not meeting so many people. You're actually carrying out your virtual meetings. You do not allow visitors. So taking a personal example, when we had on the other side, we wanted some work to be done because our works are going on. I was very, very impressed by the way the builders actually took up, they put their foot down in a sense that we cannot allow visitors inside the premise. So that should be the firmness when you are managing your visitors, interviewing candidates, or anyone. Specifically, when you take a self-declaration form which has been given by a respective government, so that you would know that the individual has come from a particular zone which may not have been in a containment zone, but probably it's a hot zone for you or a red zone for you. Ensure that you make, keeping that record at your end. To the extent that even if you are on different levels, how I maintain is, if I travel from even one floor to the other floor, I make sure that both the floors, my security, as many times in a day, checks my temperature without fail. So that is very important, that your security, your first point of contacts, who's at your reception, because I've only seen people wearing masks and gloves, maybe perhaps taking your temperatures. You are exposed to many of these visitors, many of these employees traveling and coming to your office for work. We have those shields. It's a very set pattern that, please, the person who's in maximum exposure to people coming from outside is wearing those windshields, wearing your mask, wearing your gloves. And when you have your gloves, please ensure that you're also changing your gloves. You cannot be touching the spaces around and doing and carrying out the work. So these are certain guidelines that you must maintain, because very difficult for an asymptomatic person. Also, you will have certain employees who probably would not have declared their medical health concerns. I understand this is going to be a privacy issue, but please make sure when you send out an employee data collation sheet, there is a column that say if you have a medical history. You need not ask if you're diabetic, or if you've got a kidney issue, or if you've got a liver issue. Nobody needs to declare that. But if it's a yes, the guidelines should be very clear that they must try, because they are very, very vulnerable. They must try and stay back at home. And when things start to get much, much, much better, right now we're seeing a huge spike across India, and we're already sitting at 1.98000 and still counting. So these are things that are in your hand, because should anything go wrong, you will end up being accountable and responsible. So coming on to you, yes, sir. I was about to come on to Aval, sir. So over to you, Aval, sir, because please add on to what what all of us must make sure when it comes to our building services, comes to the responsibility of an employee, because you might get even a difficult employee coming on your side and saying that मेरा बार-बार टेम्परेचर क्यों ले रहे हो, मैंने सैनिटाइज कर लिया अपने कार में, मैं तुम्हारा सैनिटाइज क्यों यूज करूं. These are the situations that you're going to face, and they will be very difficult for you, and that is where you have to draw the line. So over to you, Aval sir.
So I in fact want to bring out a very important, interesting aspect of and each one of us has been hearing about this social distancing norms, right?
Physical distance.
And some of us may have heard of this new concept of the 6 feet office. Now, where is this magic number of 6 feet or the social distancing has come from? So I was trying to dig out this information. I came upon a very interesting note which said that before the year of 2000, the CDC in the US used to operate on a guideline which used to say that between a caregiver and a patient, you need to maintain a distance of about 3 feet. But after the SARS, which was termed as CO1, which was another virus which is closely related to the coronavirus, had broken out in in the East Asia during the 2000s, the early 2000s, there were several studies that examined the infection rate of healthcare workers. And with that, they suggested that maybe the 3 feet distance is actually not enough. And the study hypothesized that the droplets, so when you cough or when you sneeze, your droplets actually go up to a distance of 6 to 8 feet
Now even they say
or
20 feet,
two
sir.
meters, right? And then in the years that followed subsequently, they actually again analyzed and they realized that actually, even with the H1N1, which had come up in the 2009, the influenza outbreak, they realized that actually you have to have a minimum of 6 feet distance between a caregiver and the patient. And so that became the new norm, and the CDC expanded its guideline to recommend now that 6 feet is the minimum distance that needs to be maintained. So when we speak about social distancing and when we speak about the 6 feet office, the 6 feet, or what we need to remember is that 6 feet is the minimum that we are recommending. If you can maintain 8, 10, 12, it is better.
Nothing like
And especially in an environment, if you observe that there is somebody around who's coughing or who's sneezing, it is all the more important that we make sure that we stay away, because the droplets are going to jump to that distance. And as we are aware that today the coronavirus, whatever we know of it as of today, is spreading because of these droplets and the virus that is part of these droplets. Now, whether they are resting on different body surfaces or on hard surfaces is where these get picked up. They get into from our mouth and from our nose into the lungs, and that's the organ that it is attacking. So I think it is very important. And if we actually look at the Spanish flu, which killed millions and millions of people, the majority of the people that got impacted or died was in the second wave. And that was the time when everybody had let the guard down. So after having gone through the lockdown 1 and 2, 5, and now the unlock 1, people are rejoicing. People are into the markets. People are onto the streets, and people are like, okay, nothing can really harm me or nothing can impact me. But
this
this
is
is
probably
time
the
to
most
actually
Now, Major,
get very, very worried, because
just
the
the right
moment you let your guard down, you will have a problem.
totally.
And in facilities, it is all the more critical, because if you have even one confirmed case of corona,
yeah.
to understand the entire facility will need to be locked down and re-sanitized, and again the entire operations of that facility or that business is going to go to square one.
Yeah.
And therefore, for each one of us as individuals, as employees also, it is very critical to understand that it is not only for us, but it is for our peers, it is for the people and our colleagues, it is for our organization. It is important for everybody that the precautions that we've laid down, wearing of masks, using of sanitizers, maintaining the distance, and using all kinds of precautions, whether we are sitting and eating our food in a canteen, one person on a table, or maintaining that social distance, carrying food and water from home, bringing our own cutlery into the office, do not rely on the cafeteria, and so on. I think there are so many aspects which are being told to people, but
Yes.
it is upon us, upon the people, to really make sure that we actually adhere and follow those guidelines.
If I may
Yeah.
add here, Major Aval, what you are saying, if you would just take it out of a corporate where it is your own employees and just apply it to a co-working, because it's a co-working operator who's actually asking their clients to do these things, and
Right.
clients are like, so it's a different perspective altogether, because it's ultimately at the end of the day their clients, and they're like, why are you doing this to me, and why am I supposed to do this? There are a lot of people. So people, if their employees will not listen to the management, just imagine if it's a tough client like that, making them understand that it is for your own safety and it is for the safety of your family and your loved one here and
So
here.
you have a difficult child to bring up, ma'am. So you have a very difficult, in fact, not child, but you have difficult children to bring up.
Yes.
But I think,
But
in
we
fact,
need
very
to tell
interesting.
them that you cannot invite 10 people, external people, into the premises to host a meeting, because it is just not safe. And those people who are coming in cannot stand and fight with the security and say we refuse to give our history. You cannot say we will not fill your form because you are asking for our travel history. It is for your own good. You cannot say that I need my cafeteria food, otherwise I don't know where to eat. There are people who actually do that, because I know co-working players who are already implementing all these procedures. They had already stopped food deliveries and had said, if you want food delivery, walk outside the campus, because we cannot allow these strangers coming inside right now, for the safety of everybody else who's part of our community.
So there are very interesting questions, ma'am, that are coming up. In fact, not I would have loved to take those questions later, but I think this is so relevant to what we are saying. So the first one of the questions that came up, and I'm sorry, I'm toggling between the questions as well, so that the essence of our
we have
topic does not get lost. So one question is on how will they're talking about the delivery of the project. Is it going to be on time? Now, so I can give my live experience, because we have a floor that we are trying to do. Yes, if is it going to get impacted? Because what we said at that time, this is a disaster. This is a pandemic which was not invited by any one of us. And I'm very sure that the realistic timelines is going to be empathetically considered at all ends. So that is one. Is the project timeline going to be impacted if you start afresh and start working on it as we've planned? I don't think so. Things have opened up, so it depends how you kind of designing your project, so that delivery timeline may not get impacted, in case you understand how you have coordinated with your project work. There are other things that are coming up, that how you're going to monitor the social distancing in a common area. As Meenal ma'am pointed out, Aval sir also pointed out, every life is important, and this is your life. If you want to stay safe, and if you would want your family to stay safe, I'm very sure this is a social responsibility, that you are going to maintain that distance, right? Even in a common area, unlike what our health minister, as we saw today, the how the procession was being carried out. There was some politician who was being taken away, who was a positive case found out in our state, and the way he was sent off to the hospital was more like he's won a war, and being taken away of the victory. Those are bad examples.
I think, Major, this question is more about intersection points within the office space, within the workspace, like common areas. So I think, like I pointed out, in the common areas, in especially co-working spaces and all, and of the corporates that I know, and the people that I have spoken to, the facility heads that I have spoken to as well, and we've undertaken a research also recently. They are all making spaces, and they're all creating more space and more distancing. And yes, social distancing, I call it physical distancing. Yes, that is being taken care of in the common areas. And like we spoke earlier also, the cafeterias and the lobby spaces, the lounge areas, the meeting rooms, everything is being done as per the physical distancing norms. People are using, yeah, Suman, you want to say something?
No, after this, I'd like to ask a particular question.
Yeah, sure. So people are creating those spaces. For example, if it is a 20-seater meeting room, people are not using 25 people capacity in that meeting room, and they're using it only for 8 to 10 people, and everything is being taken care of, and that will be taken care of.
I think even the security perspective is also going to take a different turn, ma'am, because we all went in for a biometric reader. That may not be the case again when you are designing your workplace. Someone asked, "Are you going to go back to the cabin format?" There is a possibility, yes. Why not? This, as we say, this is a new normal. Is it going to stay for a long time? Considering that how it turns out, whether we are going to be successful in actually conquering this virus, then of course things may look differently. But if we really have to look about our own health and welfare of the organization, then in that case, yes, there is no harm in actually raising up your workplaces and keeping a shield around you. That may happen. You may not have linear workstations going forward. Your design pattern may change. Ma'am has already pointed out that they're already designing places where the meeting room is going to be very, very limited, because we need to make sure that you are maintaining the distance. The problem is we do not know who's a carrier. If your immunity is good, but you're a carrier, probably you're making another person with a very low immunity vulnerable to it. And it is not going to be very easy. It's not a very easy scene. It's not an easy scenario to see a COVID patient in a hospital. Even the nursing officers, even the doctors have turned out to be COVID. So when you have to talk about your facility management perspective, you have to make sure and take every little step very, very seriously, to the extent of washing your hands and then opening that toilet, door when you're coming out. And that's when you realize, oh, I just washed my hand. But end of the day, now you're opening the knob. So that means the builders also have to end up, to decide we need to make a swing door, right? A touch-free door. Yes, sir. Over to you, sir. I was going to bounce it down to you, sir.
No. So I was just thinking about this question, and this is very interesting because from a workplace design perspective, I think there in the future there are going to be a lot of design elements that are going to change. And like you rightly said, I think one of a few things that we've really missed out is, firstly, we know that our washrooms really harbor a lot of germs, and especially in India. So while we're focused on the cleaning and the hygiene within the washrooms, what about that door? And we've never, or I've yet to see a facility in India which has an automatic door for a washroom. So right from the starting, when you enter your office premises, to enabling that through an automatic door, to the biometric system or a facial recognition or some other where you don't have to actually use your hands. And I think there is a lot of voice tech that has started in the warehousing industry and the segment, but there is not so much of tech in our office environment. And I think going forward, if you actually look at it, we could also use something like an Amazon Alexa for businesses. And why not? So I think Embassy has been one of the forerunners in bringing the Alexa concept into one of our residential properties. And I've started to see a lot of these Alexa implementations in a lot of other aspects. And I think it's high time we bring something like that into our facilities also. Also, I think somebody commented on will our HVAC designs change? So yes, definitely, because now with all your social distancing. So if you look at your floor plate, what have we done in the last couple of years is we've tried to put in more people into the same space. So we've removed cabins, we've removed cubicles, and we've just bundled in people. And I think that trend is going to definitely reverse. There are going to be more enclosed spaces and so on. And therefore, which will mean that the entire design for ducting our HVAC systems will change, one. Secondly, even when you look at your air sanitization and the filters that are being used cater to the PM 2.5, right? Yeah. Now, if you look at your coronavirus or the COVID, that is 0.08 to 0.14 micron. So which means that how do you really keep the air clean within our facilities, right? So you have to focus on some of those aspects. Now, HEPA filtration also does not give you that requirement. So the entire HVAC fraternity will have to start thinking about how do we deal with
Yes.
aspects like these,
You won't
right?
believe, Major Abel, I have had this exact discussion with a client who's telling me right now the requirement is on hold because this is what we are discussing. How will we get this air filtration in place first? So that is
Yeah.
what we're actually discussing.
So, I mean, these are things, these are thought-provoking things. What we've taken as just normal and standard, now we'll have to really sit back and start
Yes.
thinking about. There is also a concept of the PoE, the power over Ethernet, and Philips and some of these companies have been experimenting with all of those. So, which means when an employee sits and plugs in his laptop into the workstation, his light comes on, his data starts flowing, and all of those aspects, I think, and that creates a touchless kind of a field environment and so on. A lot of the biophilia connecting with the nature and environment, those factors, so all of those design elements will definitely start to come in. Will it happen tomorrow? Definitely not. Will it happen in 2 3 months? Definitely not. But maybe in about 8 10 months to a year to 2 years, we'll slowly start to see those changes happening in the design element of a building.
Remember how we were talking that earlier in the 70s, how the offices used to be and how we changed the design to crunch as many people in
So,
the same
so,
square
Yeah,
feet as we
so
could.
again, talking on the on the lighter
one more
side.
thing that I want to bring out is actually, if you look at traditionally, in our office spaces, in our homes, in our washrooms, we used to use copper as a metal quite a bit.
Now you're
Uh,
talking fancy language.
no, and if you look at it, why copper and some of these traditional metals is because they were resistant to viruses and bacteria. And even if
That is true.
viruses and bacteria tried to stick on them, they would die in 2 to 4 hours.
Yeah.
And we removed these and replaced them with steel because it looked shinier, it looked fancier, and so on. And I think it's a
So
time to
so
really sit, yeah,
yeah.
really sit and think and look at all those elements. And is there a case to bring some of those aspects back into a workplace design?
So not
Yeah,
only
I
that,
have.
sir. In fact,
I'm sorry. I have in the same lines. As GBB, we work very closely with developers, owners, operators, and we help suppliers to get sources good kind of products what these developers or the owners are looking for. So when we say things are going to change in commercial spaces going ahead after this COVID, how about the procurement? How about sourcing? What kind of products we are going to hire new? And is it it's the local products we are going to like because the government of India is pushing for local products? Is it the local
well,
products? Are you going to support, or is it like no? We're
I'm
expecting
going to say
international.
no comments.
no. So right now, this is a very that's a very diplomatic and a political question. I must say, Suman, and I'm going to pass it on to Major Raval for sure. But let me answer that. Not we understand that there are certain products that for a particular project when it comes to building a facility we are quite dependent on even Chinese made elements and Malaysian elements when it comes to things like furniture and carpets and all. But it's not that there are no Indian made products that are doing pretty well, because one, the environment per se in India has to be conducive to what you're manufacturing here. And then of course now with all of this travel is also going to get impacted. We know that if things get better, and God willing it will, as we all know it should and it will. But as far as procurement is concerned, yes, go local. I'm not saying just because we are Indians and just because maybe our government of India or the Prime Minister has said so, but I think it will encourage a lot of our business people to start focusing that something can be done here within India and make quality products. But I will pass on to the head procurement for Embassy, Major Rabal, to give his
Yeah, even
expert
before
comments.
that. Yeah, even before that, about see, we can understand about the upcoming projects, because upcoming projects they can change the entire system based on the requirements. But how about existing buildings? Are we going to have new products? Are we going to procure new products?
So if you look at it from a supply chain perspective, obviously, when we look at our existing buildings, there's not too much of change that we can do apart from retrofits and refurbishments, right? We can't just break down everything and rechange, because for businesses, it's going to be a huge cost. So definitely going forward in our building design and components, they will try and look at ways of how can we work with some of these local products and material. But if you today look at the cross section of the organizations, some of the companies have been better prepared than the others to mitigate this risk of the COVID. And why they have been able to do that is because they have been diversifying their supply chain from a geographic perspective, and they've been able to reduce the supply side of the risk. Now we know that a lot of manufacturing setups depend on their supply chain to offshore countries in the South Asia region. So whether it is China, whether it's Philippines, whether it's Malaysia, some of these other countries, even going up to Europe and so on. And in all this lockdown, those are the manufacturing setups and the commodities that have been deeply impacted. And all the manufacturing material products that have dependent on localized products and inputs in raw material have kind of been able to survive and have been able to succeed in this environment. Plus, also some of these organizations where they've looked at multi-sourcing some of the key commodities or strategic components to reduce reliance on any one supplier. And also they've looked at some of these inventory strategies to buffer up against these disruptions. They've been very successful. And I think going forward, there is going to be a lot of focus from the supply chain fraternity to start focusing on products which are easily available, which will not have long lead times in manufacturing or the supply chain, but the focus on quality will continue to be maintained. So there is no let go of quality. Cost will definitely be a big factor, and I think there is going to be an emphasis of how do we optimize cost. So I won't say bring cost to the bare minimum, but how do we optimize cost? Because cost has many factors to it. So quality will have a cost, other preparedness will have a cost to it. But what is the optimum cost? How can value be delivered at an optimum cost is something that probably will be looked at.
So let's be very honest out here, Suman. If someone is asking whether it's going to be completely local made products, it's not possible right now. It is not feasible because India per se really needs to have that bandwidth as well when it comes to manufacturing products of that quality. It is from the security perspective, when you're talking about even, to the extent of access, card readers. I mean, this is not a possibility in the long run, in the short run. In the long
Yeah,
run,
in the short run, yes, but I think but once the fraternity starts focusing on bringing more or focusing on local and Indian products, I think I'm assuming that in a time frame of 1 to 2 years, we will have a number of options coming in that fit rightly into our workplace design elements. So today, when architects, a lot of builders are dependent on some of these elements from abroad, from countries in other South Asian regions, I think slowly they'll start to reverse that focus inwards, start looking inwards, start looking to really partner, collaborate with some of these suppliers, bolstering them up into trying to do something locally.
And Minal, I have a question for you. Like, because you have expertise on co-working spaces for existing buildings. So, in terms of business perspective, what kind of products, like companies, will get business at this point of time? Like because Aval was studying about smart energy saving systems or security systems like that. So what kind of products, product companies will get business during this period of time?
From co-working spaces?
Uh, Even in the commercial spaces, entirely commercial spaces.
Okay, so everybody who is, who can provide all these health and safety equipments, they can expect a lot of business, right? So sectors which are doing well right now, of course, are pharma, even FMCG is doing good. But in the commercial real estate, anybody who can provide health and safety equipment and keep your facility management equipment, everybody, all of those companies can do well. people, the pest control companies, facility management companies, because a lot of corporates and co-working spaces, they outsource their facility management. Not everybody has in-house facility management teams. So all facility management organizations can do well as long as they are geared to meet the global norms, and they are geared to do this kind of standards.
I understand. This
I
is
think,
more
Suman,
of
to your question, I think where you are headed. So there is definitely going to be a lot more technology that is going to come into the workspace in terms of IoT-driven devices. More sensor-based solutions are going to come in. So we've already seen implementation like smart energy meters. We have connected thermostats and environmental controls. We have motion sensors for knowing where occupants are within the floor plan and so on. We have more diagnostic sensors for machinery, and there are more and more sensors that are coming in for the overall building management systems, right?
BMS, yes.
And building management systems were also traditional building management systems were the wired systems. And we all know, as a matter of fact, in FM, that most of these BMSs do not work because while during the fit out stage or at some stage in point in time, their wires have been cut or people can't trace the wires and they've been running in a half-baked manner and so on. And because of that, a lot of new solutions in sensor-based are available. And I think that's going to get implemented over a period of time. Even from a security perspective, I think a lot of security sensors, a lot of cameras, and we've already seen that, access control systems and the newer technologies to ensure security and safety of employees. And these will get implemented in and around our buildings, controlled and monitored through centralized kind of control centers and so on. So there is definitely going to be a lot more technology that's going to come into our space. How we book meeting rooms, how we interact for our food, how we are able to interact between people, how we are able to book facilities and so on is everything is going to be technology.
Actually, Major,
We do expect that maybe some of our elevators, some of our elevators could be voice activated, or some of the elevator companies could come up with apps. So you don't really need to touch physical buttons, but you have a mobile app. You use that app to really press a button of which floor you want to get into.
So,
So we are going to see a lot of
yeah,
those aspects.
this technology is not something that is new. This technology within the facility management operations, as Sir said, is already into existence. When you're talking about BMS and you're talking about, even to the extent when you have your own cars today, you really don't need your keys or the flip buttons. If it's probably lying in one side of your pocket, you can still open up your car, right? So this technology is nothing new to the facility world per se. It's just that we have been, each to his own. If your pocket permits, then you probably end up implementing that solution, right? So that is where probably the entire corporate structure or the infrastructure, it has to be driven into one direction, because all of us are looking into cost optimization as well, right? And from here on, now, because of the economy that has been hit so badly, we have to ensure that we are not overspending. So that is one of the biggest challenge that is going to come to a facility management head, that please contain your costs and do what is only necessary and required. So that is another aspect when it comes to operating your facility, how well you are doing it, in the minimal that you have. That is I think also going to start becoming one of your prime focuses.
Okay. So to just add to what Major Raval was saying, that so a lot of this technology, what you were saying, Major Raval, of booking meeting rooms and stuff like that, that already exists, especially in the co-working spaces and all. Everybody is using apps and all to book their meeting rooms and facilities. And in fact, that's what my business is. So we provide an app for people to book meeting rooms across all co-working spaces. That's what we do. Yeah, but what you were saying, that you now have technology that you can figure out not only for co-working spaces, but for corporates as well, that which workspace, which workstation is right now occupied. And there are companies who are adding a layer of health solutions to that. So you can figure out So what is the body temperature of the particular employees who's working? So you can actually monitor that out of your 400 workstations, how many are being utilized right now? Is physical distancing being maintained or not? So can this employee work from home, or is he working from home today? Is he working remotely today? Or is this employee in the organization today? Out of 400, how much is the space utilization on a particular day? And that is, those kind of solutions are also being implemented. And that's already, but those are things which are already in the market, and they are being implemented and being taken up in a bigger.
There is one question that has come.
Right. And so my point was that while a lot of this technology is available,
it is not.
Many organizations are using it, but a lot of organizations are not using it. And I think the whole emphasis and the focus is now going to be on technology going forward.
Yes.
And you will see more and more adoption of all of these technologies.
But as Major Aditi said, right, so in the near future, short term, cost is going to be like very, very important, because right now there is a huge cash crunch. And we've been talking all about corporates. But please remember that the backbone of India's economy is the SMEs, which are hurting very, very badly right now. They are hurting because of this lockdown very badly.
Yeah.
I know a lot of them personally. I'm in a lot of SME groups, and the story is totally, totally different. Sorry. Yeah. So
I have one question. We are talking about ventilation, HVACs in commercial spaces. Are we going to are we changing the existing HVACs, or is there any other alternative for that?
So, okay, so sir was sipping his coffee. So Suman, when it comes to new projects, yes, if the designs were made for a particular micron, it has been reduced, because as he mentioned, it is going to be very difficult when it comes to the HVAC system. One has to obviously also follow the ISHRAE guidelines, that is one, and also make sure that, you know, certain measures are taken into consideration. When it comes to the existing, there is another cost attached to it, you know, so this is something that has to be in sync with the builders, because, you know, there are some own facilities, but there are also multi-tenanted facilities, so that's a cost that's going to take a hit to all of us. So there is a possibility one can do that, but when it comes to designing your new floor, you have to ensure that you're looking at the, as he said, 0.8, 0.3 microns, you know, and the design that we're looking at, the HVAC, that needs to be taken into consideration. It is also advised, I mean, but these are larger spaces, but if it is not such a big space, it is also advised that you might as well not go for a complete HVAC system, but, you know, try and have, you know, the window ACs, as they call it, the split ACs. That is also a preferred, you know, solution as on date. So if anything else Major Aval has to add on, please, sir, please feel free. But to my sense, that's the way it is going to be in future.
Yeah, so I think my perspective is that in the existing facilities, the complete HVAC may not be replaced, because obviously it's a huge capex that is involved in that. But I think there's a lot of thought going around in trying to explore around the filters. And what we can do around that piece is what can we bring in which will safeguard against circulating of the coronavirus virus per se as such. So I think that is going to be probably the focus for the existing facilities. But definitely going forward, I think a lot of HVAC design experts and a lot of the companies themselves are really looking forward to how do they deal with this problem of the COVID, which is 0.08 to 0.14 micron. And how can they ensure that the air that is circulating does not actually carry this through and circulate it to other areas and contaminate the entire areas. And also looking at some of the new concept around the biophilia. So bringing in more nature, more lighting, maybe bringing in UV. And we all know that hospitals utilize UV for sanitization. And can we have UV implementation within our facilities to sanitize and deal with some of these viruses and all? So there is a lot of thought that is going on. There are a lot of discussions that is going on around what can we do.
So, Suman, with the existing facilities, please ensure that you clean your air filters. This is very important. We have done that before even we opened up the facilities. That is important. So, just do very simple measures that has to be taken care. That is one. Two is just check from your builder if the fresh water has been added or not. If it has not been added, please add a disinfectant to it at least. Because then again, for a builder, again, it's a cost to change the water. So do that. So these are things in the existing facilities you will have to do it. There is no way that you can call an employee on a floor and you say, you know what, okay, I will switch on the HVAC which has been shut down for almost 2 months. No. Anyways, the moment you come onto the floor and you do that, there is a bad stench that falls across the entire floor. And since I've been here, so I know about it. And you have to do the disinfection of the entire facility. So this is very important.
I think now, Suman, Major Aditi and Major Abel, there are a lot of questions. So if one of you can address those questions, they're all for FM.
So I think most of the questions we tried to answer, ma'am, the top ones. I'll go on to the geopolitical disruptions, including other natural calamities, possible civil unrest, war threats. Other than, I know that the current situation is probably compelling all of us to start thinking about our facilities from a BCP perspective. As far as the war threats are concerned, the corporates are not really planned on the borders. That's one. But when natural calamities like cyclones are concerned, it is a design element that has to be considered. But this is something that the builders or the organizations, yes, it is going to change. And Aval sir, please, kind of add in your thoughts from this perspective.
I think a lot of organizations will have to start looking at their force majeure clauses in their agreements very closely now. Because this was one clause probably everybody would just brush aside and say, Acha, okay, theek hai, ho gaya, kind of thing. But now we've seen that a lot of supplier partners, a lot of facility operators have started raising up these clauses in terms of such crisis.
So that's a fight I would like to have with you. That's the fight I would like to have with you, sir, because so this is, like when we say the act of God, right? The force majeure. So there was one particular segment where the builder said it isn't. And there is a one particular segment where the FM head said it is, right? Because both the parties are equally impacted. And that's the argument that, we will probably like to have with the builders per se. At the same time, I think it's a very mutual understanding, because if you have been working from home and if your data centers have been operational, right, maybe your employees have not been on floor and probably you have not used the facilities per se when it comes to the maintenance or the deployment of your staff or deployment of their staff. That those are the point of contentions, bone of contentions that one can argue upon, and looking at the management fees or whatever it is. But or maybe a rent-free scope, or maybe a delay of rent. But yes, that's an argument that I would like to, very openly like to have it with the builders for sure. That's the cost.
Sure, but I think, so from that perspective, only to my point that I think the force majeure clause, and it works for both the occupiers as well as the providers. So landlords as well as for the organizations, I think they need to relook at what will entail a force majeure and what are the factors that are incorporated in it. So in the BCP document, I think this will also become a key element going forward with all the experiences learned. So
there is a very interesting question. Sorry, sir. There is a very interesting question due to paucity of time.
There is to the rent. You are continuing on this question?
No, ma'am. Due to the paucity of time, I'm taking the next question.
And this question, like to contribute on this.
Yes, ma'am, please.
Because a lot of people ask me, because all my clients are, of course, fighting with all my service partners as to we want rent waivers, and some are giving, some are not giving. But I think from the landlord's perspective and from the client's perspective, both, it has to be an amicable solution, and both parties have to sit and agree to it nicely, and no party should be like, do what you want and do what you want. But the other thing is, all the clients are obviously looking only at their perspective. They need to look at the landlord's perspective. If the landlord owns the building, fine, but they do have their overheads also. They have employees who they have to pay salaries to. They are taking care of the facilities. They are keeping it ready for the the clients to come back to. There are IT buildings which are keeping the client servers running. They are paying the workers, the construction workers, everybody. So they do have overheads, and people are just forgetting all those aspects.
Yeah, and as I also said in the beginning, I think builders are putting in a lot more investment into raising the standards of digitization. So they're investing in a lot of other equipment and material and supplies, and money has to come from somewhere.
So we have a very interesting question, and I'll probably take on that because since being in the thick of it, and this case is that if you have a positive COVID case on your floor, when you open up your facility, what do you do? What happens? So first and foremost, there is too much of English anyways around it. It has been very explicitly mentioned that follow certain steps, which is one, your employee data collation, very important. But let's say by default, there has been an employee that has come onto your floor. The first and foremost, you have to have the isolation room in your facility. In that isolation room, the individual has to be taken, your business manager, anybody who's your nodal officer or the HR manager, whoever is the controlling person or the contact person has to be informed about the individual. You have to know where exactly the individual has been sitting, what are the other places that he's been to. But primarily what will happen is that anyone who's been operating out of that site, whether it's a multi-tenanted facility or whether it is your own facility, everybody has to be kept informed. Where has he come from? That is something that contact tracing will happen by the BBMP authorities or any authorities. You have to immediately inform your number that has been given to you. Like in Karnataka, you have a 104. You have to inform them. They will come and they will take the individual in the ambulance. This is the first step you have to do. When it comes to the premise, for 48 hours, the first thing you have to get your facility disinfected. You have to get a disinfection done, which is going to be carried out by your own service partner. Ensure that this disinfection is not compromised. Let the BBMP or any other government authority give you a clearance that the facility is ready to operate. But in my knowledge and in my perspective, within 48 hours, the facility should be okay to operate. And this is how it works. But the people who have been in and around in your facility at that point of time, when your facility individual employee has been found COVID, the rest of them, again, the close contacts have to again report for a COVID test, including others, but they have to be home quarantined, whether it is your security staff, whether it is your housekeeping, whether it is your employees. Anyone who has been on the floor has to go back and to be home quarantined. Of course, please follow it up with a COVID test. Very, very important, because if the employee has been floating around in your office for a couple of days, it makes more sense that you go and inform your PGs or your RWAs and your own family, which needs to get quarantined. So do not compromise on these things because this is very important.
Okay. I think we are done with most of the questions, and we are also running very much over time.
Yeah, ma'am, I think we are. So
we are already.
Now, yes, ma'am. So I think the last question was how do you do temperature checks on a bus? The buses have already been given the instructions. The way you do it, in fact, they're also doing so. That is all we have for you all, and thank you very much.
Suman, if there are any other questions or anything that come to you, you can mail it to us, and Major Aditi and Major Raval will be more than happy, and even I will be more than happy to answer them, and you can then mail it to the participants.
So
one last question from Venkatesh, who is from Sobex. He is the head of facilities there. I know we have answered this, but I just want to bring this up. How to handle huge crowd movements inside the bay? How about food part? Can we use a packed food, or food can be served as usual?
Okay, so within the premise, you anyways will not have you will not be allowed to have a percentage beyond 33 right now, right? You have to make sure you are doing a 2 gaz ki duri, which is 6 feet in English terms. You have to maintain it, because you will be liable for a visit from any official BBMP official in Karnataka per se. for a surprise check. So if they find that you are not following the MHA orders very strictly under the IPC Act, they are liable to book you under an offense and shut it down, shut your facility down, and you would not want that. So make sure that one, you're following all these orders. When it comes to the food cafeterias, this again is a very personal decision. You encourage people to bring food from home, but if there are situations that let's say employees are coming from PGs and they are unable to get food from home, please go and do check from the source that you're actually getting food boxes. Your steel plates are getting replaced by paper plates, or even the natural plates. So do that. Get your own cutlery and crockery, as sir said, ma'am said. Water paper, the water cups are coming back into action and everything's getting removed. But food packs, if they are sealed packs, even the packs, when it comes to snacks, they are being disinfected and cleaned in our facilities. The food is again a very big question. It is a very individual decision depending of how you have gone and audited from where the food is coming into your place. Home food encouraged.
Vijay, but our corporates, sorry, I'm asking another question now.
But sure.
Are corporates like the size of yours and people who have like corporates who have like 3 lakh, 4 lakh employees, are they actually having cafeteria food allowed like now or in the next couple of
months? There are organizations who are actually taking packed foods, but cafeterias are not operational because you can, if as I speak today, there are hardly even 5% of employees operating out of any of the organization. So the work from home continues, but there are businesses that would like to operate from the office. No one is actually going 33% as we speak today, which is on 3rd of June. Say, what is the date today? 2nd of June. But over a period of time, you would want to have the business back. So it's better that we are prepared today. We know where your food is getting cooked. You have to understand that you have to go and do an audit check, how it is being delivered. If is your food vehicle being sanitized properly? Are your food handlers, do you have the medical certificates from your food handlers? Are there in PPE or not? How is it being served? Are the employees going to serve themselves, or your food is going to be served by the handlers? These are the things that unless and until you're standing on ground and getting that done, it will not work. You cannot sit in your office and actually say that, you need to do this. This is the English given to you. That it does not work like that. As I said, walk the talk. So make sure that whatever directions you're passing on to your team is being disseminated and being followed upon. So Suman, that is the answer to the gentleman, that this is a very conscious call and a very responsible call that an organization has to take, whether it is food packs. There are agencies and hotels, even, because we know that the business of the hospitality segment has also come down. In fact, they have volunteered to come up and give you food packs at a very affordable cost. Organizations can look at that, and the deliveries can happen in that manner. So this is a call that every organization has to take it on its own. You cannot have an employee working for the sake of the organization and tell him, what, I don't care if you're working in a PG, but get your own dal chawal. It is not possible for a person who doesn't have a family out there, and you expect work out of it because the revenues are hit. So again, a very humanly call, but make sure that you as an admin head or a cafeteria head or a hospitality head are ensuring that your food deliveries are being done very well and consciously.
Okay, thank you all. Thank you everyone for sharing your insights. It was really very informative. And this is, and I thank the audience as well. This has been a live broadcast, and it's been recorded, and we'll be uploading on our website to watch for you, or you can share it with your colleagues. I have discussed with the panelists. We're coming out with the next webinar. It will be about infrastructure and workplace design. So what's going to happen next, and the lessons we're going to learn from that. We will share the details, more details about this in a couple of days. Again, I thank all the panelists, Major Aval Sethi, Ms. Meenal Sinha, and Major Aditi. Thanks a lot. Thanks a lot for your time.
Thank you, Suman. Thank you, Minal ma'am, and thank you, Major Raval. I think, as I said, that the idea was not to have a planned webinar, but thank you, Suman. I think it was a great thought. We could actually share what we've done on ground. And thank you to all the participants who made an effort to be a part of the session. It really means that we are very serious about what we are doing. So all the best to you all, and stay well and stay safe. And Jai Hind from Major Aditi. And I'll always be in touch with you anyways. Thank you.
Thank you, everyone.
Thank you.
Thank
Thank
you,
you so
sir.
much, everyone. I would just like to repeat that the responsibility to be safe and keep our loved ones safe is on all of us.
And as I always
so let's do it again.
Yeah. And as I always say, Suman, if you've not logged everybody, let everybody come onto the screen so that we can see their faces, and let me all wish them safe life. So if they all can come on the video and switch on their videos, it'll be so nice that I can see them all.
Must have blogged.
This would have been
because I had to promote everyone. So
no problem.
Okay, bye everybody. Thank you so much. Have a great day.
Thank you.
Bye.
Thank you.